I've seen many patients over the years who have not had an open conversation with the doctor taking care of their disease. What do you tell patients who are still struggling yet they're under care?
A relationship is a two-way thing, right? That as a patient, I can control how I present myself to the doctor at the appointment or the health provider at the appointment. And I can control how well prepared I am to have that conversation.
I think that's so important about preparation, uh, even rehearsing. And, I tell this to doctors that I teach that, having that empathic communication with the patient is really the secret to finding out actually how their condition is doing.
Yeah, and just like there's no one size fits all for the treatment plan or the care plan, there's also no one size fits all for how that communication should happen.
So once that conversation occurs, the patient and the doctor are on the same page. How can that change the journey?
For the patient, it feels much less like you're alone trying to fight your disease on your own. It feels like you have someone by your side, like a true partnership, even though you might only see your provider once every 3 months because you've had this really deep dialogue and you're on the same page. You feel like your doctor's still there with you, helping you along your care plan.
And once that openness occurs, that logically can potentially lead to new treatment options.
My provider has really helped me open my mind to the fact that we might have to change the treatment plan or my care plan and not to be as afraid of that as I used to be.
So, how can the patient assessment tool, like the one found on the Room for Dialogue website, help patients open up that kind of conversation?
Yeah, I think as a patient, it can feel so overwhelming to keep track of so many different things in your life. And whether it's the pain or the fatigue or how your disease affects your daily activities. And when your doctor asks you a question and you haven't prepared ahead of time, sometimes people just freeze, like, oh my gosh, I can't remember. So it's crucial to make the most out of these appointments. So having access to resources like the patient assessment tool on the Room for Dialogue website is so important because it just guides you through what questions should I be thinking about before that appointment and helps organize my thoughts.
Cheryl, I just want to say it's been a real pleasure today. I enjoyed all the conversations.
Thank you so much. All right, shall we?
Let's get on.
Yeah, let's skedaddle.
If you're living with a rheumatic disease, then talk to your doctor and visit roomfordialogue.com to learn more.